I think that's the bigger issue, really, is that this could be, when I first heard about this, my first thought was, hey, this is a good way to cut out the middleman. Instead of giving all this money to the insurance companies, government subsidies to not just government programs, but private companies that provide insurance, we can cut out a lot of that potentially, eventually, and save the taxpayers a ton of money. And, we just don't tax the pharmaceutical companies quite as high. Like, you're ending up with a pretty close to the same result. But the manner of how we're getting there is, instead of taking money away from people to fund this, we're just dropping all of the extra middleman stuff that cost extra money.
Now, obviously, the majority of people in the United States have some form of insurance, whether that's Medicaid, Medicare, or private insurance through their work, or even just self-pay insurance, medical insurance. An important aspect, because there are millions and millions of people who do not have insurance. Right.
If you go to a hospital, it's very expensive. But if you go to a walk-in clinic, it's usually like $100 a visit or something like that. And a lot of them will say, hey, if you pay $80 cash right now, you're good.